Lower body lift is one of what I consider the keystone operations when we treat bariatric patients. As they lose weight, you lose weight all over your body, not just in your arms, your legs, and certainly the truncal area is one of the areas that undergoes some of the most dramatic changes from massive weight loss. For me personally, it's probably one of my most favorite procedures to perform because the changes that you see are really dramatic. I think one of the important things first is to understand what exactly is involved in a lower body lift and what are the components so that you understand the kind of changes that you might see. First and foremost, the part of the lower body lift is essentially an abdominoplasty. When we perform an abdominoplasty, we remove the extra hanging skin and fat from the front side of the abdomen, and that really has a dramatic effect on a person's physique and a person's contour. Also part and parcel to the operation is the creation of a new belly button or a new umbilicus, correction of any muscle weakening, or what people describe as muscle repair. And also if patients have any hernias, which are very commonly present, these can be repaired at the same time. Moving on with the procedure, we also will reduce and lift the pubic area, and this is a very common problem in weight loss patients, particularly in women, and an area of real concern and frustration for most patients. As we extend around the outsides to the outside of the thighs, the next portion of the operation is essentially a lateral thigh lift. And this allows for removal of excess skin in the flanks and lateral thighs and lifting of the lateral thighs and smoothing out of tissues on the outside of the legs. Finally, as we go around the back, it involves essentially a buttock lift. And this involves removal of excess tissues, again, around the posterior or back portion of the waist, lifting of the buttock, tightening of those those tissues, and in many patients, augmentation of that area by preserving some of the fat that would otherwise be removed. Some patients describe this as, or it's referred to as, auto-augmentation, and essentially a band of tissue that would otherwise be taken away is left intact, and then the elevated skin is brought over the top of it, and it allows for better prominence of the buttock area. The reason we do this is that one of the byproducts of weight loss is that you lose your butt. And as you lose tissue in the buttock, you get flattening of the buttock. And a result of lower body lifts is that you'll get excessive flattening or an exaggeration of that flattening. And people like having more shape in the back area. And so by preserving some of these tissues, we can give them a little bit better shape and definition. Lower body lifts, when we go to perform them, it's very important to adequately screen the patient and make sure that they're good candidates for surgery. And when we look at timing of the procedure, we really want to think about weight stability. Everyone who has bariatric procedures loses weight at a different rate, so the actual amount of weight isn't as critical as the stability of that loss. And for some patients, they may stabilize in as little as 9 or 12 months, and for other patients, it may be 2 or 3 years. So when patients come in and talk to me and ask me, well, when will I be ready, it's really a matter of when your weight is level. The way they know that their weight is stable is all of a sudden their weight is no longer changing, and that's when they're ready. Once we go ahead and decide that a patient is ready for surgery, we do certain metabolic screenings to make sure that nutritionally and medically that they're appropriate for surgery. So we'll check vitamin levels occasionally, we'll check their blood counts, and just make sure that all the problems that can occur from bariatric procedures, malnutrition-related issues, are not a problem. And once they're medically cleared, then we proceed with the surgery. The surgery itself is done under general anesthetic. It takes between 5 and 6 hours to do, so it is a long procedure, and it's done in a hospital setting. We'll keep the patients in the hospital overnight generally, and most can be discharged the next day with follow-up in the office. Occasionally, patients will need to stay an extra night for a variety of reasons. Either they're traveling from a far distance, so travel back and forth for appointments may not be practical, or they just may need an extra day for recovery before they're ready to go home. Once they've had the surgery and they're recovering, the next thing people want to know about is, well, when can they go back to work and what will their activities be like? In general, recommend most patients to plan on being out of work between 3 and 4 weeks after a lower body lift procedure. It's a big operation. You know, when we do these procedures, we may be removing 10, 15, 20 pounds of tissue from the mid-body or the lower body, and that has really profound physiologic effects on the body, and it takes time to recover from that. Exercise and things of that nature take about 6 weeks, 6 to 8 weeks, and that's more a function of allowing the tissues to heal adequately so that the wounds themselves are strong enough to tolerate, you know, the stresses of exercise. Also, in general, you know, for the first few weeks, you're just not physically ready to exercise because you're really pretty wiped out from the procedure. You know, the results from the lower body lift are really dramatic, and that's probably the most gratifying portion, gratifying thing about performing these operations, in that they're so dramatic, and you can literally take someone who looks a particular way and has all this excess hanging skin and really give them a very sleek and often slim physique with one operation. As long as they maintain a stable weight, the results are permanent. They're not going to stretch their skin out to a significant enough degree to develop the same problems, and they'll enjoy that body the rest of their life. Now, one caveat is that, you know, in younger women, women that haven't had children and are planning on having children, some of them may have some stretching of the skin if they get pregnant. And so having a desire for children later on is not a reason not to have a lower body lift procedure, but certainly you have to consider that and realize that you may need to have some sort of revision procedure once you're done having kids in order to tighten up that skin that's been stretched out from pregnancy. But having said that, patients who have this are just thrilled and really happy with the results, and you know, I'm very happy and thrilled to be able to provide those kind of changes to these patients because it really transforms their life.